Welcome, everyone. Today is Tuesday at 10. We are thrilled to have you all here today. My name is Jean Ann Cannon. I'm the director of Dunebrook, and we are so excited to have Miss Lori and Miss Michelle with Franciscan Alliance, SANE nurses who are rock stars in our eyes. And we're going to be talking to them about what they do. But we also, of course, have Miss Angie Marsh, who is our director of our Child Advocacy Center. And Angie has great experience and will explain what that advocacy center is. And of course, Lisa Scheller, our development director, who will give you a little bit of what's going on with April events this month. So very briefly, Dunebrook, 33 years old, does child abuse prevention and intervention, two very different things. And especially with the crazy year of pandemic, we have happy to report that we have successfully continued to present all of our programs, both intervention and prevention. Prevention wise, our healthy families for expectant moms or new moms, if you're expecting or you know anyone, that is a support system where we go into the home and talk to parents now virtually. And give them all kinds of wonderful support for parenting issues. And in fact, you get a free pack and play. So if you know of anyone who's interested in getting some information on how to better parent or parent ideas, give us a call. Public education goes into the schools and empowers kids to take care of their bodies. It's taking the social stigma away from the topic of child abuse. And if you see something, say something to someone and get help. And our new parent and family education program, where there are actually classes that you can sign up. So those are the prevention pieces. The intervention piece, which really is 33 years ago, how Dunebrook started in helping children suspected cases of abuse. So Angie will kick off our questions with both Lori and Michelle. But before we do that, April is our Child Abuse Prevention Month nationally, and Lisa is our rock star on that topic. So take it away, Lisa. Give us a little info before we get into our interview.
Yeah, absolutely. So as Jean Ann had mentioned, it is Child Abuse Prevention Month in April. And we have had some great events and things happening in the community. So the pinwheel is the symbol of child abuse awareness. So if you've seen these pinwheels around town throughout LaPorte County, Porter County, or where have you, that's because it is bringing awareness to child abuse. And then we have our t-shirts that you might have also seen people in the community wearing. Children are locally grown. So we want people to know that we are growing our own children here. And so it is our job as a community to protect those children any way that we can. So as Jean Ann had mentioned, we've had some special events happening. We've had some give backs going on. South Bend Chocolate Cafe did a give back for us last week, as well as Lakeshore Foods, Al's Supermarket, register fundraiser. And then starting this Saturday, Cablin's in LaPorte and Michigan City will be doing a register give back, and that will be at all their stores. And the Leeds Public House in Michigan City is doing a all month give back drink special. Their drink is the Dragon Fruit Cooler. That is the drink for Dunebrook. So anybody who goes there and has that drink will get 50% back to Dunebrook. Today, last week started our online auction. So you can check out our online auction online at biddingforgoods.com/Dunebrook. And we have some awesome items on there, almost 50 items. We have a Ninja blender on there, as well as some certificates to the Friendship Garden, a Fitbit, and many, many more items. So you'll have to check that out. You can check our website, Dunebrook's website, to get more information in regards to that. And then if you feel that you would like to donate to Dunebrook, you can do that by either going to our website, dunebrook.org, and you'll see a donate button. You can just push the button and it will take you to a platform that will take you on to give whatever donation you would like to give us, 5, 10, 15, 20, whatever you feel good about doing. Or you can text Dunebrook to 71777. So just go on your phone and type in Dunebrook to 71777 to make a donation as well. So we want to thank our sponsors, our garden sponsors that have contributed to Dunebrook for the month of April. And that is Leeds Public House, South Bend Chocolate Cafe, Centier Bank, Lakeshore Foods, Cabela's Ace, and General Insurance, Horizon Bank, Dan and Carrie McGibbon, Fred Miller, and many more. So again, thank you for everybody who is making this possible for Dunebrook.
Great. Thanks so much, Lisa. And that is what, of course, pays for us to continue our programs like our Child Advocacy Center. So, Angie, if you would maybe just start off talking about what is a Child Advocacy Center, and then maybe Lori and Michelle can talk about their positions and what they do.
Sure. A child advocacy center is a place where a child who has alleged abuse, so whether it be physical abuse, sexual abuse, some kind of a neglect, or witnessed a crime, whether it be like domestic violence or a homicide, that is a place where once that report has been made to like Department of Child Services or law enforcement, the family would bring that child to Dunebrook, where they would get what we call a forensic interview. And that is just a legally sound interview that can be upheld in court. And it's just a fact-finding interview. So just when to be able to elicit as much information out of that child of what has happened to them. And we do this in a way that they are surrounded by a team of people. And so the child advocacy cannot stand alone. They need to have a team surrounding them. And so it would be, while that child is being interviewed, law enforcement and Department of Child Services are listening on the other, kind of in another room, in an observation room. And so that they can hear and are able to ask questions if necessary while the child is talking with the forensic interviewer. And then the family is sitting with a family advocate at that time and is talking with our family advocate, and she is supporting them on and educating them on the kind of the interviewing process, and then kind of what to expect from their child of behaviors, and then what to kind of expect at the as the investigation kind of goes on. And she will be there from the onset of that allegation and will be with that family for years if they need help and continuing to have support for them. And kind of with that, we have law enforcement, Department of Child Services, which can also go on to prosecution, but we also have a couple other aspects of our multidisciplinary team that surrounds this family and child. And that is our SANE program with the hospitals, that we have linkage with the hospitals, and also linking that family up with mental health. And so today we have two SANEs that are with us and from Franciscan Hospital. And so I'll let Lori and Michelle just, I guess, tell us about what a SANE is and how that kind of got started at Franciscan.
Okay, so I guess I'll go ahead and start out. So I'm Lori Bridegroom. I am an ER nurse at Franciscan Health, Michigan City. I've been here for almost, I guess it's going on 12 years already. It's hard to believe. So I've been a SANE nurse 10 of those years, sexual assault nurse examiner. And just within the past 2 years, I was appointed coordinator of the program here at our Michigan City and our Chesterton campus. Kind of funny enough, and one of the questions everybody always asks when I share what I do is, how did you get involved in something like that? So I was still a newer nurse. There was a sign hanging in the nurses station that said, if anybody's interested in more information on becoming a SANE nurse, sign your name. So I thought, well, that sounds kind of interesting. And I was really, truly just looking for more information at that point in time. So I put my name on the list. Next thing I knew, I was told I was registered in this course, and these were the dates I was going, and I was kind of like, but at the time I was scared to say, like, I really just wanted more information. I don't even know if it's something I want to do. So of course I went to the class, and my passion just kind of, started there, and it, just keeps getting stronger. For years, I just did adult cases, and then realized what a need we had for the pediatric piece of that program. For years, we were having to transfer patients out, which becomes very difficult. First of all, and we all know it's a bad situation anyway, and then to have to tell somebody, we can't help you, we're going to send you an hour from here. So finally found a course that I was able to attend with my work schedule. That was, I guess, about 2 years ago. And that's how we started developing then our pediatric program here in Michigan City. Then, of course, obviously, it's not something you can do alone. So then obviously I started looking for other nurses to join. That's how Michelle got involved. And then, and obviously then, you know, our resources, you know, in the community. So essentially we get cases 2 different ways. They would come in through, you know, what we call our triage area, our front door. And then also, we also receive referrals from Dunebrook.
Sorry, I wanted to mute myself a little bit just because I had emails coming in. So I wanted to get that off of there. And it was one time just trying to get set up. We were having to send families out, and it was just very heartbreaking for these families to be kind of overwhelmed when they came into Dunebrook, and then just saying, you know, it'll be late at night and saying you're going to have to drive to, you know, over to Mishawaka or St. Joe County to get these exams. And sometimes these kids did not get these exams then as they were going through. And I know that, you know, having an exam, part of it is, I guess, just telling what would be kind of the purpose then for a child to have an exam, a SANE.
Well, sure. I'll just introduce myself too real quick. My name is Michelle Runions. Hello. I've been an emergency room nurse for 12 years, been with Franciscan Alliance for about 8 years now. I primarily work midnights. Lori approached me about a year and a half ago in regards to the program, and I was all for it. So I'm pediatric, adolescent, and adult SANE certified. The one thing that we're noticing a lot is it's not just LaPorte County. We are seeing advocacy from Porter County, St. Joe, like just even Stark occasionally. So we aren't just seeing LaPorte County. We are encompassing everyone around. Anybody that comes through our door, it doesn't matter what location you come from, we're here to help you. And that's been the eye-opening, because we've been seeing more and more cases that aren't just in Michigan City or LaPorte, they're in other counties, which I'm glad
So they come to you because they don't have the program at their hospitals in their area?
Correct. As of right now, Porter County, besides our program, which we do offer our services off of Chesterton Emergency Room off Indian Boundary Road, we will do cases, adult, pediatric, any case there. But Porter County doesn't have a program. So we've been extended over to Porter County, and through word of mouth, we've been advocating for other people and other programs to come this way, other like CPS or police departments. By word of mouth, we're seeing more and more cases, not just this county, but other counties as well, which is good.
Yes, and so we're actually very fortunate in LaPorte County that both our hospitals have SANE programs and pediatric SANE programs. I know Olivia spoke with you. She did a fabulous job.
We love Olivia.
Yeah.
She's so sweet.
And we do a lot of collaboration. And I was thinking about this, and I laugh when I say it, because, you know, our phone calls start out, oh, I'll just keep you for a minute. And then like 2 hours later, you know, it's like, I really have to go. But like I say, we're very lucky in this county that both our hospitals, you know, offer these services, because sometimes even having to travel from Michigan City to LaPorte or LaPorte to Michigan City can be difficult for some families. And I guess just kind of piggybacking on what Michelle said. So obviously when a patient comes to us, whether it be through our front door, through law enforcement from Dunebrook, obviously the most important thing for us is to make sure that the child is okay and that they know they're okay. And then from there, obviously, depending on the situation, there may be forensic collection involved. Obviously, we're, you know, looking for, you know, any injuries that may need to be treated, any sexually transmitted infections that may, you know, need to be addressed. But like I say, most important to us is always that child feels okay.
And I think that's, we have protocols around what, what children kind of come to and what we refer to the hospitals. And it's been wonderful to kind of collaborate. Both Lori and Michelle, you guys are awesome on just being, kind of called in the middle of the night if need be, or when it's, on call. But the biggest importance to us as well is letting that child know that their body is okay, that what had happened to them, and that they can go and have an exam and from head to toe and know that they are going to be all right. And it is also a huge relief to the families as well. And so I've seen, with with being able to collaborate over the last year or two with both the hospitals, is how much appreciative the families are of knowing exactly, and our family advocate has gone and kind of done a little bit of research on, like, this is who you're going to meet up with. This is exactly what you do when you walk into those doors. And so that the family does not have to take that on, and we'll try to get that set up before the family leaves Dunebrook so that they don't have to kind of worry about making another appointment. So I've just really appreciated.
We also work really closely with the families of the victims too, especially when they come in. It's a scary, and initially it's the unknown. So we work one-on-one with the family, the parents or the caregiver, whoever brings the child in. We explain the process very detailedly, and we work as a team. Nobody's out of the loop during this entire visit, and that's important to us.
It is. And I think it is the education that you're giving the families is so important, just to let them know and be reassured of, what is going on and what's happening to their child, and what, will happen, and how their child may react, or just that they're going to be okay.
Yeah.
So Michelle and Lori, can I just ask you, given what you've just said, such a scary thought, suspected case of child abuse. So they come into the ER, and how you, not only what I hear Angie saying, what they feel so good about is that you end up after the exam that their body is okay. But for anyone listening and being fearful of coming forward or asking for help or going to an ER or calling Department of Child Services or Dunebrook, the reason why it's okay to call is because they're in such good, loving hands when they come into the ER, correct? So
Correct.
Can you kind of give, just an idea of why a parent or anyone should be okay about coming to the ER with a case where they suspect there's abuse, and why if you don't come in, it's so not good?
I think it's important that people come in. We are a safe place. We are a safe environment. We immediately take those patients back to the room. We sit and we talk to them. We offer a lot of comfort. We go through this procedure. We talk about the importance of why these exams are needed, not just acutely, not just right there in the moment, but upon discharge. We go over a lot of information as follow-up on how families can deal with this, how to talk to children, what children may do, how to communicate, how to feel about this. We talk a lot about where are your safe emergency contacts upon discharge. Who's your emergency contact at school, or who can you trust and talk to outside this visit. We try to establish a network of safety beyond just the ER.
And I encourage everybody and anybody. So obviously we've heard of mandatory reporters and teachers and nurses, and but everybody should consider themselves a mandatory reporter. And so if you see something or suspect something or think something isn't right, I encourage you to take that step, because you maybe end up making a total difference in a child's life, in stopping something. And it is very difficult. It is very scary. We actually had this conversation this morning with another group. Obviously, it's not something we want to talk about. A lot of people don't want to hear about it. But unfortunately, it's one of those things where it does exist, and it is more prevalent. And I think Olivia had even pointed out the statistics of how prevalent this is. And without getting the word out to the community, and raising awareness, those numbers are never going to get any smaller.
And you're right, Lori. I think it's 1 in 10 children will be abused by the time they're 18 years old. 1 in 4 girls and 1 in 6 boys. And just making that first call, the first step anybody can do is to make the call to either Department of Child Services or law enforcement. That would be the very first step that a family would do if they suspected that there was any kind of abuse going on, whether the child has told them something. And like you said, everybody is a mandated reporter in the state of Indiana. And so if you have seen something on a child, or if a child has told you that there is something going on, or you just see some signs or hear some signs that is going on, if you have any suspect that there is child abuse, then you would need to call the 1-800 number for DCS. And it's about 70% of people don't really know who they're supposed to do after they find out that there's, there might be some abuse going on, but what do I do next? So you call Department of Child Services. It's 1-800-800-5556 and make the report to let them know of what you suspect, what that child's name is, and just any kind of facts that you may know. You don't have to solve anything. You don't have to know for sure. They'll go out and investigate. They get law enforcement involved right away. They bring that child into Dunebrook. We take a statement, and then it goes to get a medical exam and then on to mental health. And so we have kind of a process that we have that is working really well in LaPorte County. And I know that you were saying earlier that you had kind of an increase of out of county states. And I know we'll have children come in from Pulaski County, Stark County, and Porter County, because we serve those counties as well. And knowing that they don't have SANE, exams in those counties, a lot of times we will see, you need to go over to, Franciscan or to LaPorte, let's get you set up and get you in to see a nurse and get that taken care of. So we appreciate you taking in everybody encompassing and being wide open. So
I'm glad that we actually are seeing more out of county, because that means the word of mouth is getting out. So that's important, that educating and letting people know that these services are here is important.
It is. And I know we do a lot of education kind of with law enforcement and Department of Child Services, as well as, they said, well, it happened a year ago. Why would we need an exam? And it's just to let that child know that they're okay, that there's no, sexually transmitted disease, that their bodies are okay, and that they're going to, be productive adults when they get older, that this, and kind of get the mental health as they, process as well when they go through.
So kind of, I hear you all saying that, one, if you see something, say something. As you're saying, Angie, you don't need to diagnose, you don't need to know for sure, but to call and make that report.
Yeah, a lot of times with, especially with child sexual abuse, which is what we see more at Dunebrook, is a child has told somebody. And so, or they have overheard them telling a friend. Maybe they haven't really told an adult, but they're talking about it with a friend, and people overhear things. So if you hear anything, just, give that a call and let the investigators look into it.
Yeah. And Lori, I think you said that, again, coming into the ER in Michelle, that it's very safe there. It's very safe, not only physically safe, but emotionally safe. And all too often we hear, of course, in the news, and 30 years later, finally someone says, what happened to them as a child, and how you can save a lifetime of really trauma. Because it is a traumatic thing that happens, and not that we can erase what happened, but we certainly can help the individual and the family
to move forward.
Yeah.
You want to talk about that a little bit, Lori? I mean, why what you do really does save the child's life, not only physically but emotionally, and the family.
So again, like I originally said, the big thing for us it is assuring the child that their body is okay. Depending on the age group, there's different talks that kind of take place. A concern and I hope this is like a topic that's okay to talk about, but a concern in our early teens, it is a question of, does this still mean they're a virgin?
Yeah.
And so that's a conversation we have. Again, we talk with the parent, we talk with parent and the child, we talk with the parent, because we want the parent to feel okay too, and know that their child is okay.
Right. And to kind of taking that whole social stigma away from the
Correct.
that this happens, and we can deal with it, and we can give you help for it.
Right.
And we do a lot of reassurance, not just, with the child specifically and with the parent both. A lot of reassurance that you will be okay. Things are going to be okay. We're going to give you those steps to help you heal from this and be mentally and physically better by the end of our visit.
And that it's nothing that's necessarily going to be instant, but it can be achieved. Yeah.
Gosh, that's wonderful.
Such great information.
Yeah.
Great
I would
information.
imagine in the moment you guys mean everything to them, and they just love everything that you tell them. And as Angie said, that there's additional support after they leave the hospital and or leave Dunebrook, and for the individual and the family. Is there anything else you want to add? Anyone? Thoughts, topics, questions? Anything?
Did you guys see any difference between, kind of the year COVID and what kind of cases came in?
Yeah. So I would say kind of during the height of COVID, and obviously when a lot of kids weren't in school, I don't know the statistics there, but I would imagine that that's a lot of reports come from schools. A lot of kids obviously were doing it online. I mean, we definitely saw a decrease in adult and pediatrics. And then kind of as things kind of started opening back up, we did see a spike.
I think overall with COVID, we had a bit of an increase in CPS abuse cases.
Yes.
We did see an increase with that in general. Domestic battery, we saw an increase in that, unfortunately, as well. We did have a little bit of a lull period with sexual assault, but now that the things are starting to lift, quarantines are starting to lift, we're starting to see an increase.
I think that has been kind of across the board with the DCS and law enforcement as well. The domestic battery and physical abuse kind of spiked, and then the sexual abuse kind of went down, but now it's kind of going back the other way as to normaling out.
Yeah, unfortunately, we're seeing an increase more so.
Yeah, we are at the advocacy center too.
Mm-hmm.
So.
Right. And wow, isn't that just a community-wide issue, is increasing
Right.
stress? And instead of hiding or being ashamed that you're stressed or grappling with conflict or problems within your home, it's okay to reach out and get the help you need. So, well, ladies, honestly, thank you so very much. First of all, I have to say your personal commitment, just being a nurse is a big deal, but being a SANE nurse and what you do and the personal commitment, and you've been there for so many years, just kudos to you and thank you. I really thank you.
Thank you.
Thank you for having us.
Well, you are in our eyes like saints on earth, and we I don't think you hear that enough, and we do believe that. I know Angie and Lisa, I'm sure, have the same sentiments, and the fact that you collaborate with LaPorte Hospital and you're getting stronger and stronger with your experience and your education in the area is really kudos to both hospitals in LaPorte County.
Yeah. Well, and I feel like, just to kind of touch on that, Olivia and I both feel like this is this is a community effort. And again, we certainly appreciate everything you guys do, because again, it's nothing, I feel like it kind of goes back to like, we're all, the spokes on the bicycle wheel, and, without one, it's just not gonna run right. So, it really takes everybody and takes a team.
It really does,
and Dunebrook has been fabulous in, with the MDT and kind of bringing everybody together, and a chance for us all to collaborate. And it certainly makes a difference.
It does. And I think that analysis is with that child and family right at the hub of that spoke or the wheel, and where all the spokes coming out just to help support them. So. Yeah.
Right.
Well, thank you, Angie. I know the CAC, our CAC has a great reputation. Lisa, thank you for all you do to
Well,
help
thank
our,
you guys for all that you do. It certainly takes a community to,
Yeah.
a team of
Right.
people
Yeah.
to be
And I
there for
think
people
this,
and let people
yeah.
know the resources that are out there and how it all comes together. So,
Yeah. And more of just this type of education, the average person to not be afraid of the subject. As you
Right.
said, we'll leave it, Lori, with great advice. If you see something, say something. Angie told us what to do. Call Department of Child Services. Tell them what you know. You don't need to diagnose. Just tell them what you know, and have wonderful people like Michelle and Lori and Olivia. Doing what you do. We're very appreciative. So thank you so much. And with that, we wish you the best of luck in this coming year.
Thank you.
Thank you.
Transitioning back to somewhat normal will be, I'm sure, have its challenges, but we thank you again for joining us today, and we wish you all the best.